Okay, well, good afternoon, everyone. Thank you for joining us today. My name is Mike Montez, and I'm one of several personal advisors here at MediGap Advisors. And I'll be your host today. My colleague, Mr. Tom Lockwood, will also be joining me today to discuss the ins and outs of Medicare Advantage plans, how they work, what you should know about them, and how they can benefit you. During next week's webinar, you'll learn all about the best ways to take advantage of the current open enrollment period, so stay tuned for an email about that, or simply visit our website to register. It'll take us approximately 20 minutes to go through the basics of what Medicare health plans are all about and how they work. And if you stick with us until the end, you'll know more about them than the other 99% of Medicare beneficiaries out there. And more importantly, you'll learn how you can get the most value out of your health plan year after year with our help. The information we'll cover today can potentially end up saving you thousands and even tens of thousands of dollars during your lifetime. So to avoid any distractions, we currently have all the phone lines muted. At the end of the presentation, we'll go ahead and take some questions if you have any, and you can also use the chat box to your right to type in your questions as you think of them. One quick disclosure, due to Medicare's strict guidelines, this webinar is intended for educational purposes only. So we won't be able to address anyone's plan-specific questions or how one carrier's health plan works compared to another. However, we will be able to give you some exact instructions on how you can go about getting those specific types of questions answered, if you have any, at the end of our session. Lastly, I want to note that MediGap Advisors is not affiliated or endorsed by CMS, Medicare, or any other federal agency or state organization. So with that said, let's go ahead and get this started. Tom, what can you go ahead and tell us about Medicare Advantage plans today?
Thanks, Mike. Well, let's begin by asking the basic question, what is a Medicare Advantage plan? Medicare Advantage, also referred to as MA, we have to have an abbreviation for everything, plans, are health plan options that are approved by Medicare and are run by private companies. They're part of the Medicare program and are sometimes called Part C of Medicare. MA plans are offered in many areas of the country by private health insurance companies that sign an annual contract with Medicare, who in turn pays these private plans for their members' expected health care. MA plans provide Medicare-covered benefits to members through the plan and may offer extra benefits that original Medicare doesn't cover, such as extra vision or dental services, to name a few. Keep in mind that most plans have special rules that its members need to follow. With a Medicare Advantage plan, you receive all Part A, hospital insurance, and Part B, medical insurance, covered services through that plan. As I mentioned a minute ago, some MA plans provide additional benefits as well. Many plans also include Medicare prescription drug coverage, also known as Part D coverage, Part D of Medicare. In some plans, like HMOs, you may only be able to see certain doctors or go to certain hospitals. As you might expect, benefits and cost sharing in an MA plan may differ from original Medicare. It's important to note that when you join a Medicare Advantage plan or other Medicare plan, you are still in the Medicare program. Medicare pays these private health plans for your care every month, whether you use services or not. You still have Medicare rights and protections as you do with original Medicare, and we'll discuss some of these later in the presentation. In the event that the plan decides to stop participating in Medicare, you will have the opportunity to join another MA plan or return to original Medicare. If you join a Medicare Advantage plan, you must continue to pay the monthly Medicare Part B premium. Part B premium in 2014 is $104.90 a month for most people and will remain the same through 2015. A few plans may pay all or part of the Part B premium for you, and some people may be eligible for state assistance based on their income. When you join an MA plan, there are other costs you may have to pay, such as an additional monthly premium, deductibles, coinsurance, and copayments. As I stated earlier, these costs may be different from original Medicare, can vary from plan to plan, and they could be higher if you go outside the network. So let's talk about who can join. These health plans are available to most people with Medicare. To be eligible to join a Medicare Advantage plan, you must be entitled to Medicare Part A and enrolled in Medicare Part B. You must also live in the plan's geographic service area. People with end-stage renal disease, ESRD, usually can't join an MA plan or other Medicare plan. However, there are some exceptions. For example, an individual who develops ESRD while enrolled in an employer group health plan may be allowed to enroll in an MA plan when transitioning off of group coverage without a break between coverages. A person who receives a kidney transplant and no longer requires a regular course of dialysis treatment isn't considered to have ESRD for purposes of eligibility. To join an MA plan, you must also agree to provide the necessary information to the plan, agree to follow the plan's rules, and belong to only one Medicare Advantage plan at a time. You can join a Medicare Advantage plan either when you first become eligible for Medicare, for example, during your initial enrollment period, which begins 3 months immediately before your first entitlement to both Medicare Part A and B, or during the Medicare open enrollment period, which we are currently in. You can also switch to another MA plan or to original Medicare during open enrollment, also known as the annual election period. This period runs from October 15th through December 7th each year, with coverage starting January 1st. You can only join one MA plan at a time, and enrollment in a plan is generally for a calendar year. Plans must be allowing new members to join. In some cases, plans may be prohibited from accepting new members if there is a CMS-approved capacity limit or an enrollment sanction is in effect. You may be able to join or switch plans if any of these following special circumstances that grant a special enrollment period apply to you. You move out of your plan's service area, or you're enrolled in a plan that decides to leave the Medicare program or reduce its service area at the end of the year, or you leave or are losing employer or union coverage. You enter, live at, or are leaving a long-term care facility. If you qualify for extra help, you have a continuous special enrollment period, meaning you can enroll in or switch your plan at any time if you lose your extra help status or eligibility. You can also join or switch to a plan that has a 5-star rating. And receiving a retroactive notice of Medicare entitlement would also qualify you to join. Please note that this is not the full list of special enrollment periods, but these are the most common scenarios. There are other exceptional circumstances. So how do plans achieve a 5-star rating? Medicare uses information from member satisfaction surveys, plans, and healthcare providers to give overall star ratings to plans. They get rated from 1 to 5 stars, and a 5-star rating is considered excellent. At any time during the year, you can use the 5-star special enrollment period to enroll in a 5-star Medicare Advantage or prescription drug plan, as long as you meet the plan's enrollment requirements, for example, living within the service area. You may use the 5-star special enrollment period to change plans one time between December 8th and the following November 30th. Once you enroll in a 5-star plan, your special enrollment period ends for that year, and you're allowed to make changes only during other appropriate enrollment periods. Your enrollment will start the first day of the month following the month in which the plan gets your enrollment request. Plans get their star ratings once a year, in October of the past year. The plan won't actually have the rating until January 1st, but will be assigned the rating in October before January 1st. Currently, there are very few plans throughout the country that meet this criteria. If you belong to a Medicare Advantage plan, you can switch to Original Medicare between January 1st and February 14th. If you go back to Original Medicare during this time, plan coverage will take effect on the first day of the calendar month following the date on which the election or change was made. If you make this change, you may also join a Medicare prescription drug plan to add drug coverage. Coverage begins the first of the month after the plan receives the enrollment form. You may not join another MA plan during this period. It's important to remember that anytime you enroll in a new MA or prescription drug plan, it will automatically disenroll you from your previous plan. Our advisors can assist with this process if this is something you're interested in pursuing or have additional questions about. There are special trial rights for a special enrollment period available when you join a Medicare Advantage plan for the first time. You're eligible for this trial right if you either joined an MA plan when you were first eligible for Medicare at age 65, or were in original Medicare enrolled in an MA plan for the first time and dropped a MediGap or Medicare supplemental insurance policy. The trial right allows you to disenroll from the MA plan during the first 12 months and return to original Medicare. You also have a guaranteed issue right to purchase a MediGap policy. There are 5 common types of Medicare Advantage plans. Health maintenance organizations, or HMOs. You generally must get your care and services from doctors or hospitals in the plan's network, except for emergency care, out-of-area urgent care, or out-of-area dialysis. Second type is an HMO point of service. In some plans, you may be able to go out of network for certain services, usually for a higher cost. This is called an HMO with a point of service, or POS, option. Preferred provider organizations, or PPOs. In a PPO plan, you have a network of doctors and hospitals. However, you can also use out-of-network providers for covered services, usually for a higher cost. Then there are special needs plans. Medicare special needs plans are Medicare Advantage plans designed to provide focused care management, special expertise of the plan's providers, and benefits tailored to enrollee conditions like diabetes, end-stage renal disease, HIV or AIDS, chronic heart failure, or dementia. And lastly, private fee-for-service. In a Medicare private fee-for-service, PFFS plan, you can go to any Medicare-approved doctor, other healthcare provider, or hospital that accepts the plan's payment terms and agrees to treat you. All people with Medicare have certain guaranteed rights and protections. You have these rights and protections whether you're in original Medicare, in a Medicare Advantage plan or other Medicare plan, have a Medicare drug plan, or have a MediGap policy. All following basic rights are guaranteed. You have the right to get the health care services you need. You have the right to receive easy-to-understand information. And you have the right to have your personal Medicare medical information kept private. If you're in a Medicare health plan, in addition to the rights and protections previously described, you also have the right to choose health care providers in the plan. You have the right to get a treatment plan from your doctor if you have a complex or serious medical condition. A treatment plan lets you directly see a specialist within the plan as many times as you and your doctor think you need to. Women have the right to go directly to a women's health care specialist within the plan without a referral for routine and preventive health care services. You have the right to know how your doctors are paid if you ask your plan. Medicare doesn't allow a plan to pay doctors in a way that interferes with you getting needed care. You have the right to a fair, efficient, and timely appeals process to resolve payment and coverage disputes with your plan. You have the right to ask your plan to provide or pay for a service you think should be covered, provided, or continued. You can also file a grievance about other concerns or problems with your plan. For example, if you believe your plan's hours of operation should be different, or there aren't enough specialists in the plan to meet your needs. You have the right to obtain a coverage decision or coverage information from your plan before getting a service to find out if it will be covered, or to get information about your coverage rules. That's also one of your rights. Your plan must tell you if you ask. And of course, you have the right to privacy of your personal health information.
Excellent, Tom. I appreciate you going over this topic in as much detail. As a reminder, of course, the enrollment deadline will be here before we know it, and we urge you not to wait until the last minute to take action. If you're not yet working with one of our friendly Medicare experts, simply call the main line toll-free at 1-866-323-1441, listed on the screen. and your call will be routed to a licensed advisor that can assist you. From that point forward, you'll be able to communicate with your personal advisor via email or phone whenever you have any questions at all about Medicare. You can also schedule an appointment directly on your advisor's calendar for a day and time that's convenient for you. And because it's our busiest time of the year, keep in mind a number of appointment slots have already been taken. So again, call the main line if you don't yet have an advisor assigned to you. If you are working with us already, reach out to the advisor directly by phone, email, or by adding yourself to their calendar. We'll answer all of your questions, guide you in the right direction, and help you determine the best course of action. Keep in mind that we represent all the top carriers and plans throughout the country, so we can help you find the plan that works best for you in your situation. And each year we'll conduct an annual comprehensive policy review to ensure that you're always kept in the highest value, lowest premium plans available. And best of all, we can do everything for you from start to finish at no cost to you. So that concludes today's presentation. We'll now go ahead and open up the line in case there are any questions out there. And in the meantime, I'll go ahead and show one of Tom's many excellent testimonials. I'm a very satisfied client. Let me go ahead and open the line up here. If you do have a question, you can go ahead and hit *6 on your line, and that will unmute your phone, and you'll be able to ask your question or questions. Otherwise, you can also use the chat function on your screen and be able to ask the question that way as well. Again, it's *6 if you do have any questions for us. Okay, well, I don't see any questions coming in at this time. Once again, we want to thank you all for taking the time out of your schedule to join us today. We hope you got some value out of the presentation. Also wanted to remind you of the upcoming webinar focusing on the open enrollment period, which takes place next week. It's actually, I believe, at 4 p.m. Eastern Time, but you might want to check the website. Probably by tomorrow it should be updated on there. It's going to be on the same line. We hope to see you there. Hope you have a great rest of the evening, and we'll talk to everyone soon. Thanks, and bye for now.